And before we get started, I would just like to make note that the Honorable Dr. Lamar White will be joining us by telephone today. And all of my distinguished colleagues are here with me in person. So as we move down the agenda here, we'll go to Section 2, approval of the agenda. And then Section 3, Mr. Chambers, I'll turn it over to you since all four of those are for you. Under the recommendation or recognitions.
So I think Monday night is going to be an exciting time. I think I'm very proud that Dr. Hale and HR, we discussed it, and we do a great job of honoring our teachers, our support professionals, and we had decided we want to also honor and recognize our outstanding administrators. So this year, for the first time in a long time, we will be recognizing on Monday secondary principal of the year and assistant principal of the year, and elementary principal of the year and assistant principal of the year. And at the secondary level, as well as the elementary principal, they have the ability to go to the state level. And right now, we already know our assistant principal is also the state assistant principal of the year at the secondary level, Ms. Hickson Wells.
Wow.
And is also in the running for national assistant principal of the
That's awesome.
year. So it's kind of exciting, but we will be recognizing these four individuals on Monday, and we'll have some nice words for them.
All right. And so we'll move past Section 3 to Section 4, which is visitors, and we have none at this time. Section 5, administrative personnel appointments. 5.1, appointment of assistant principal 2, 10-month to Bruner Middle School. And 5.2, appointment of assistant principal 1 on temporary assignment, 12-month. And Mr. Chambers, do we want to talk about 5.2 real quick?
And and just for the record, the 5.2, this is also money that has come from the state, and they have asked every school district in the state of Florida to have, in essence, what is called a data scientist. And as you can imagine, I'm sure none of the 67 districts have a data scientist position. So this is how we are handling it. This position goes through October of 2021. So we're excited to be able to do this and meet all the requirements and regulations that the state will set forth for this individual to do.
Okay, and data scientist, what is that going to curtail? So,
Ms. Lightbourne, coming up.
so the general public will know what this person's going to be doing.
So as Mr. Chambers said, it is a grant from DOE that runs through the end of October. That person will be collecting all of our progress monitoring data on our students and submitting that to DOE. They will be helping with our online programming, so they have to have some technical skills as well. They'll kind of be the bridge between our MIS department and our curriculum department to make sure that all of the programs that we're using are going well and being used as efficiently as possible. The big piece that DOE wants is all of our data in a certain way, which they haven't shared with us which way yet, but once we know what way that is, then it will be this person's job to collect it and get it to DOE as well.
Okay. So I do have a question. This is going through October of 2021. So this is actually a temporary position. Is there any thought of making this a permanent position after the October?
So as you know, we'll go through the next budget period. This is a temporary position. Now that we do have some thoughts on how we might utilize a position like this with many other responsibilities as we go forward.
Okay.
But right now, it's a temporary position.
Okay. All right. All right. Thank you. Board members, any other thoughts? Okay. Thank you, Mr. Chambers. Thank you, Ms. Lightbourne. And so we'll move down to Section 6, public comment. And of course, we will not know until that night. And then Section 7, committee and staff reports, in-county travel paid for the period of November 21st through December 9th, 2020. And now we're down to Section 8, consent agenda. 8.1 will be the approval of the consent agenda. 8.2, approval of the workshop meeting of December 10th, 2020. Minutes of regular meeting of December 14th, 2020. 8.3, appropriation of District 1 school board member capital outlay funds to Shalimar Elementary School for cafeteria tables in the amount of $9,240.88, presented by Dr. Lamar White. 8.4, appropriation of District 3 School Board member capital outlay funds to Florosa Elementary School for media center carpeting, media center flooring in the amount of $19,731.49, presented by Ms. Linda Vanchek. And 8.5, renaming of Okaloosa Technical College and Choice High School to Okaloosa Technical College, and that's presented by Kelly Hayes, and she is in the audience if you have any questions. And 8.6, request to advertise a public hearing for adoption of revised School Board Policy 04-18, extracurricular activity, eligibility, and participation guidelines for high school students, grades 9 through 12.
Okay, I'm sorry. Can I go back to 8.5, please?
Yes, ma'am, you may.
Okay, sorry. Yeah, she's coming. So my only concern, I know why we're changing that in the recommendation, but what are we going to do with the Choice High School part? How are we going to know that it's there and just the logistics of that?
You want me to handle that? Okay. So, what used to be Choice High School, Ms. Vanchek, is not there anymore.
Right,
There's
right.
not a Choice High School. What we run on our campus right now is a dropout prevention program for middle school and high school students. So it's a program on the campus of Okaloosa Technical College.
Okay.
Those students are all referred by counselors. They can't come in off the street to that program. So as far as knowing, they would know through their guidance counselors.
So there'd be no reason for people to actually know it as an entity, okay?
No, ma'am.
All right, I just
The
wanna
only
make sure
the
that-
only other piece we have is the other part of dropout prevention that's on the campus, which is the Twilight program. We advertise. We really don't have to advertise that. That's a word of mouth thing. But the counselors also help us with that part.
Okay, all
Okay.
right, great. All right, thank you.
All right. Thanks.
Anything else, Ms. Vanchek?
No, thank you.
All right. All right, so we'll go back to 8.7, budget amendment number 3, fiscal year 2020 through 2021. 8.8, monthly financial statement for November 2020. 8.9, invoices to be approved for payment. 8.10, payroll warrant register and accounts payable warrant register for November 2020 totaling $28,714,669.73, and bank transfers for November 2020 totaling $10 million. And 8.11, ITB 21-02, custodial chemicals and supplies. 8.12, ITB 21-04, fire alarm certification and repair. 8.13, renewal of tag-on bid RFP 151702, dispensing system for general cleaning supplies. 8.14, tag-on bid over $25,000, Granger. 8.15, service agreement number 21-63, Brent Purcell. 8.16, service agreement number 21-64, Connect ASL Incorporated. 8.17, controlled open enrollment school capacity report for the 2021-2022 school year. And Mr. Horton, would you like to come up and talk about this?
Thank you, Chairman Bryant. Just an opportunity at this time each year to share with parents something that is required in Florida statute, controlled open enrollment, and if they've lived in Florida for a long time, they're aware of this. But essentially what it does is it allows parents to request open seats in schools in attendance zones at which they do not live. So when we grew up, it was the waiver process, attendance waiver. It's now called controlled open enrollment. It is a requirement in law that all school districts have controlled open enrollment plans and that they make seats available for students that don't live in attendance zones, if there are any available, based on capacities. And so this district and this board has always been as accommodating as we can be to have parents make choices for their children to attend school. So what this capacity report does is it looks at the plant, the school building, and the capacity in terms of student seats, and projections, which are as challenging as ever for student enrollment. So I wouldn't want to say we're holding our feet to the fire on enrollment projections right here, but we're still in that process, and then determining if the school has any reasonable capacity for students from outside the attendance zone. And so keeping in mind that we always have to maintain some available seats for students who live in an attendance zone. So we would not allow students from outside an attendance zone to come in and take up all of the seats in a school physically to where we'd have to bring in portables and other things, but it's a process by which parents can make that choice. And so after the board's consideration and possible approval on Monday night, this capacity report will be posted on our website. We'll do a call out to parents notifying them that the controlled open enrollment window is beginning. It's an application window, and it runs from January 15th through February 15th. It runs this early for next school year. Again, we're talking about seats in next school year because it does take a long time to collect enrollment information, to plan resources, to plan for teachers at schools. And all this is being said in the midst of the COVID pandemic. So we're operating as though we're expecting schools to open normally next fall. And so that's obviously a caveat. But once this controlled open enrollment window closes on the 15th of February, there may be some schools where there was a high interest and we have more students and parents applying than we have seats available. Then the law requires us to go through a lottery process, which we will. We've got that set up. We've been doing it for a number of years. That lottery process does give preferential treatment by Florida law to certain groups of students, including military dependents whose move resulted from orders into our area, or a move resulted as a result of orders, that they would be given preference in any lottery. There haven't been too many schools where we've had to enact a lottery. Once we get past February 15th, we'll notify parents of their assignments if they're approved, and then any schools that have remaining seats available will continue to allow parents to apply for those throughout the spring and summer. So we want the parents to have that opportunity. We want the military families coming in to have that opportunity, and so we'll do that. And then there is a final caveat to this that is a hardship appeal. And so parents will see when they go online and look, there's the capacity report school by school that shows which schools have space. There's a frequently asked questions document that'll answer hopefully some of the questions that new parents in our area will have. And there's also an online application piece. It's very easy for a parent to request a seat in a different school. So all that's automated, and we certainly have paper copies available to help folks who don't have internet access. But the hardship appeal, there could be a specific case where a school is at capacity, but it's potentially possible for, under certain circumstances, for a parent to be accepted to have their child attend the school. So that process will occur after this controlled open enrollment application window. And so we'll provide parents with information about that. All the documents are on our website, and making sure our schools, because that's where parents call first, our schools, that they're aware of all of the steps involved. But we've been doing this for about 4 years now, and it's running fairly smoothly. Generally speaking, the schools that had some space last year still have space, and schools that were at capacity are at capacity still. So there hasn't been much of a change on that.
Any
I have a
que-
question.
Yes, ma'am.
First of all, I'm looking at the list, there's a lot of closed.
Yes, ma'am.
How does this compare to years past?
Well, when we first started, there were more openings. So as an example, I know at the beginning, there were some openings at Pryor, there were some openings at Niceville High School, there were some openings in the north end that are not reflected now. So I think, save this year where the pandemic has impacted our enrollment, the enrollment has been increasing, so that's going to naturally lead to more schools being closed. Now, the other thing I want to keep in mind is, and I mentioned this earlier, is, if I were to go to Riverside, which is showing it's closed, that doesn't mean there are not some seats available, because as I mentioned, we have to make sure we hold a percentage of seats in that school for in-zone enrollment. And so we take that into account, and it's all in our controlled open enrollment plan, which is located on the website as well, that explains how we come up with our capacity numbers.
And how, you mentioned the pandemic, how are we balancing this with the number? I know it's kind of hard to predict because we don't even know going forward what next fall will actually look like. But as you're looking at this, we have a certain percentage of students who are not in, and these numbers are about being in brick and mortar, correct?
Well, they are, Ms. Ivanchek, and that's a great point, because, but I'll give you an example. If we had 1,000 students at Shoal River now enrolled, and 300 of them were online in My School Online, so the building looks relatively speaking emptier this year. It would be irresponsible for us to let 300 kids from outside of that zone come in and fill that school, because when these 300 that are online do come back, there won't be any room for them.
So
when
you're
we-
looking at enrollment, not
Yes,
so much
ma'am.
where
Yes,
they're
ma'am.
enrolled or, okay.
Exactly
okay.
right.
So
We have
we've
to
already
consider
taken
that.
that in account.
Yes, ma'am.
That's my concern. Okay, thank you, sir.
Mhm.
Okay, any other questions, school board members? Okay. So, thank you, Mr. Horton. And now we'll move down to section 8.18, Employee Assistance Program Services Contract between the School Board of Okaloosa County and Pattison Professional Counseling Center for counseling service rendered during the term of the contract. 8.19, High Quality Curriculum for Reading Grant Application. And 8.20, K through 12 Civic Literacy Book List Grant Application. All right. So now we'll move down to section 9, Superintendent's Human Resource Recommendations. And the first two will be informational only on Monday night. 9.1, Employees on Administrative Leave, and 9.2, Deferred Retirement Option Program. 9.3, Out-of-Field Report for the 2020-2021 school year. 9.4, Employment Separations. 9.5, Personnel Recommendations. 9.6, Employee Transfers. 9.7, Employee Suspension and Reinstatement. 9.8, Employee Suspension. And 9.9, Leave Without Pay. Section 10, Discussion Agenda. As of right now, there's been nothing moved from the consent agenda. And so now we'll move to Section 11, Construction Programs, Program Owners Representatives Business. 11.1, Dr. Kelly, I'll turn it over to you.
Thank you, Chairman. I passed out for everyone a copy of the agenda for Monday's meeting, and I think that Ms. Crawford also emailed it to everyone. And I'm looking forward to having our meeting on Monday to discuss those things, and I'll be able Monday night then to give you a little bit more detailed information based on what is discovered from that meeting.
All right.
Thank you.
Thank you, Dr. Kelly. And we will look forward to your presentation on Monday night. 11.2, Authorization for Professional Services Agreement from Faithful and Gould for price validation for program number 6, task order number 2, district-wide school security upgrade project phase 3, the final phase. 11.3, Authorization for Professional Services Agreement from Faithful and Gould for price validation for program number 6, task order number 11, roofing project. And then 11.4, TPM program number 6, task order number 11, scope modification roofing projects. And section 12, information technology seat management contract. 12.1, CACI task order number 2-181 for transportation cordless phone project. And section 13, Mr. McInnes.
Two items this morning, Mr. Chairman. First, I just wanted to remind the board that under your new board policy on policy review and revision, we will start the cycle in January of this year to begin a continuous review of your policies. This year, we will be reviewing and revising Chapter 1, which is the School Board Governance and Operations, Chapter 2, Fiscal Management, Chapter 3, Instructional Matters, Chapter 4, Students, and Chapter 5, Student Records. Keep in mind that during the course of the year, there will be other policy changes and revisions for things that are happening in legislative changes, but these are the 5 policy entire chapters that will be reviewed and updated this year. Secondly, we have information from FISBIT. Russ Frakes has been in communication with them. They have, under our new policy with them, when we get a suit in that they have coverage for and that they're defending, they pay all of those legal fees. We don't have any deductibles with them for fees. So they retain the law firms that are experienced in the defense of those kind of insurance cases. They want to add a couple of additional firms to their list that they would be using for the school board. Once again, they pay all of those fees. So I just simply wanted to make you aware that they have asked to inform you they would like to add the firm of Hand, Arundel, Harrison, and Sale as a defense counsel firm, and also the Warner Law Firm as a defense counsel firm. It would be among those they could use and choose for different cases depending on the nature of what the claim may be. Once again, we don't have to enter into a contract with those firms, but FSBA did want the board to be aware that they would like to add those to the list of firms they're using. So I just bring that to you for your information. If you have any questions about those, I'd be glad to answer them. They would work directly with the attorneys in those firms, and they look at the resumes and capacity and abilities of those attorneys, and they select the ones that are best suited and have the experience to defend the kind of cases that may be coming forward. There are no current cases, new cases that need to be assigned to these firms. They just would like to have them available.
So it was just informational only. We don't have to vote on it or anything. Okay, all right. Thank you, Mr. McInnes. Okay, so we'll move down to section 14, Superintendent's Business, 14.1, out-of-state student trip request, and 14.2, Mr. Chambers, you're up.
Thank you, Mr. Bryant. First of all, I wanted to take this opportunity to to recognize the school board. As some of you may know, that this is School Board Appreciation Month, and I think this is a great month to have it. We come back from the holidays, and it's January. I want to thank you all for the work that you've done over the last number of years, and Ms. Gardner, of course, joining the board now, and the work that all of you will do. I absolutely appreciate, as superintendent, the support that you all have, the input that you provide, the fact that you're out in schools, you speak with staff, so I feel like this is a true team, and I absolutely appreciate that. I know that you will probably get spoiled over the course of this month, but just want to thank each and every one of you, and Dr. White, who's on the phone right now, just want to thank each and every one of you for what you do, but happy School Board Appreciation Month.
Thank you.
All right, thank you.
You're welcome. Also want to just let you know, I think you may have received an email from Ms. Lightbourne. We did get our reopening schools for the second semester plan approved. I know Ms. Lightbourne was extremely excited back in December when we received notice, and then about 7 days later the plan was due. So she was excited to get her people together and formulate that plan, because there was no pressure, because all it meant was we had to figure out how to educate our online students and make sure that we get funded. So no pressure on that. But Mrs. Lightboard and her staff, and collaborating with others, so I appreciate the fact that that was done. Also, this is going to be a little bit lengthier, okay? I do want to give just a little bit of a COVID update and kind of where we are in Okaloosa County, kind of give a picture, a feel for what this first semester has been like. But I want to kind of start by saying, you think about 5 years ago and what an educator's role was. And, and this is simplistic, but simplistically for a teacher, they were going to come into their classroom, they were going to teach their standards, they were going to make a difference in the lives of kids, and that's what they were going to handle. Our principals, the same. Our support staff, the same, in essence, simplistically. Then you think about how things have evolved. They had to become mental health experts. They had to become safety experts. And then last March of 2020, this pandemic hit, and it changed the way that we've lived life the last number of years. And the thing that I want to say is, we've received praises for the way that we've done stuff, and I appreciate it. We've received criticism, and I appreciate that as well, because it's an opportunity to get better and look at things and analyze what you're doing. And if we can get better, we're always open to that. And we've received recommendations, which I also appreciate, because once again, someone wanting to be part of the solution. So I do want to say that this school year has been challenging would be an understatement. And I just want to go through it. I'm going to go through a few items here, okay? So you start looking at something that's been completely new to educators and really new here in Okaloosa County. So you start thinking about the safety protocols that we've implemented. You start thinking about the new employee leave protocols that we've implemented and that we've gone above and beyond to make sure that we take care of our employees. You think about Zoom meetings. That has changed the way that people have done business, and it's actually probably been a positive piece in terms of something that can be taken once all of this is done in a way to do things even more efficiently. But we have some teachers who have always been very adept at technology, and some maybe who didn't necessarily like technology that much, and yet they are now, in essence, experts in technology and the way that they're utilizing Zoom and other pieces. You look at, it was already a challenge to keep up with the mental health needs of students during a time where the pandemic was not an issue. Now, during the pandemic, we're keeping up with mental health needs in the brick and mortar, but also for those students who are online, and our mental health counselors and others doing a great job keeping up with those students. You look at our ESE students and our ELL students, the same piece. Keeping up with those students in brick and mortar, but also keeping up with the accommodations and their needs for those students who are online. And that's a challenge. We talk about contact tracing, which we're going to go deeper into in a little bit, and how that has changed the way that we do business. We now have, in essence, a COVID administrator. And that administrator's day for some places in a particular week might be doing that specifically all day, every day at the school. And you have contact tracers that will now come into a classroom, and you're breaking out a ruler or say a ruler right now, and then looking at, are we 6 feet apart, and going through that. So that impacts students as well as teachers, as well as the administrators, as well as families. You look at the new configurations of classrooms, cafeterias, the media centers, the locker halls. All of these have been newly configured, and that is what? It's another responsibility on the teacher, another responsibility on the support staff, another responsibility on the administrators, who of course are doing that for the safety of students. You look at sports and how practices are now set up, or how games are set up, the way that we hydrate our athletes, the way that they're to sit on benches, the way that they're to space out. And of course that's difficult, but they're going through new protocols for the safety of students and employees. You look at band, chorus, drama, and they're still doing a great job, but many of them, they're wearing masks as it pertains to those classes. The performances that they once did across a semester for them, for the students and for the community, right now a lot of those have been put on hold. We're starting to get to some of those now with less capacity, but with less capacity it means that not necessarily all family members can be there. And then that's a stressor. When you have 4 or 5 people in a family, maybe only 2 can go, that's a difficulty, that's a choice, and that's a sacrifice. You start looking at the new methods of instruction that teachers are having to do in the school building and online in ways that they never thought that they would ever have to do so. You start looking at teachers having to engage students in the school building and online in ways that they never thought that they would have to do so. And then what does that look like? You have teachers now who are doing 6 contacts plus to families to try to get some students to stay online. And the administrators do another 6 contacts as well to try to make sure that we get students engaged and keeping their education going. And that, as you know, is not an easy task. You look at a classroom that has 22 students one day, the next day, for the next number of days, they may have 10 students, and then keeping up with pacing, keeping up with testing, knowing that there's an FSA or some type of an end-of-course exam at the end. And those teachers want to do a great job for the students so that they have learning gains and achieve, and as well as they have pride and want to do well themselves. Then you look at, how do we maintain our historical expectations in Okaloosa County in terms of providing a strong education and doing very well academically. So that weighs on teachers, especially those who've been with us a long time. New teachers knowing that they're coming into a highly academic school district and they want to do well, but then they see all the fluidity and it becomes stressful. Grading, we've had a pretty consistent way that we grade in Okaloosa County. But now you start looking at grace and compassion, and you start saying, how are we, grading some of these students? So there's been adjustments that have been made. You start looking at students who have gone from My School Online to the brick and mortar, and then maybe from brick and mortar back several times, and that's not a negative to the family, because we want to have them making decisions on what's best for them in their situation, but that is an impact to the school. It's an impact to that classroom teacher and adjustments that have to be made. You look at what is happening behind the scenes, not at the school. You look at what's happening with our MIS department and all the technological things that they have to do to make sure that everything interfaces correctly, everything flows from the district to the teacher's computer or classroom or to the assistant principal in terms of what's going on. There's a lot of MIS work that's done differently, that's never been done before, and being done in an efficient manner. You look at what curriculum and instruction has done, and they've completely reconfigured everything that they've done from the past to be able to meet the needs of this particular time right now. You look at HR and what they're doing, or finance and what they're doing, and flowing out money in different ways, or HR supporting employees in different ways and trying to get word out, especially as it pertains to leave, but also just the stress that teachers are going through and the avenues that they have to seek different pieces of information to help with stress. You look at master schedules that are more complex than ever in order to make sure that we have the courses that students need to be able to be successful, and then guidance counselors in these new roles making sure that kids are still on target for graduation. You look at some class sizes are larger than they've been in the past during a pandemic, and one of the things that we've had to make sure of is that we match student enrollment. We have to match student enrollment with the number of instructors that we have in order to not be in a situation where we have to lay off folks. Then you look at lack of substitutes and the impact that that has had on schools. And of course, HR has done a great job to get those numbers up, but it's still not necessarily where we would like it to be. Then you look at just constant changes that have happened. The state's doing a great job, but they're having to change, and every time that there's a change at the state level, that trickles down to the district. Once it trickles down to the district, that means where is it going to go? It's going to go to the schools. And then who's that impacting? Ultimately, is going to come down to that classroom, and especially with this new reopening plan, there's a lot more expectations as well. Cleaning protocols, the way that happens with our custodians, to our maintenance and facilities, and things that have happened there. Our bus drivers, they're in a completely new environment, the way that they are doing things as well. And all of this is still happening while trying to have high expectations for our students and for our employees, but at the same time realizing where we are. Now, that was kind of an exhaustive list, just saying how things have been different, and this doesn't capture probably the half of it. But I will say, with all of that stated, there's definitely still been bright spots this year. We've talked about that already. There's definitely been heroes that have emerged during this process. People who have done things in ways that they never would have dreamed of. I'm proud that you have individuals like Mr. Palmer who are literally going to individuals' houses and delivering them with little notes and saying, hey, I appreciate what you're doing for going above and beyond. We have teachers who have adapted, support professionals who have adapted, principals who have adapted, and they're putting in long hours, and that's understandable. But the fact is, many are going well beyond their duty days in order to make a difference in the lives of kids. District staff completely doing things in different ways and being creative, and again, giving their all, and learning to control what we can, and that's a hard thing. I had a meeting with a group of teachers in December, and one of the questions, and it was a hard answer, but the bottom line was we have to be able to control what we can control and continue to give our best effort as we move forward. But I'm still extremely proud of this school district and all that's going on in a very difficult time. And it has been a roller coaster. Quarantining has impacted not only us, but it's also impacted our students and families. And one of the things that I wanted to do today as well And I'll actually pause for a second because I'm going to have Mr. Horton come up. If there's anything that the board would like to say before that, and if not, then I'll have Mr. Horton come up.
Mr. Horton.
And he's going to discuss a little bit about positivity rates, so we can just make sure that we do a good job keeping the board informed and the community, as well as some of the measures that we're continuing to take for the safety of our students and employees.
Thank you, Mr. Chambers. Board members, as you know, we have a COVID dashboard that updates as soon as we get information from the Department of Health on positive cases. We also put numbers of contact traced students on that site. We're, over the break, we're awaiting the next update to be able to update our website. But in the interim, I provided you, and I've given it to the board secretary. We'll be sure to make sure this is posted online and available. This is some information that's at the state Florida Department of Health website, and so I wanted to give it to you in context. I know there's been some information out about high numbers of positive cases in our high schools, and we do have some cases in our high schools. And as Mr. Chambers said, we've done a lot of things, and we need to keep doing things and do better in areas so that we can make the virus the safest for students. The information I've given you here, if you'll look, the column is student cases that I want you to look at. Those are the student cases at the Florida Department of Health website from September 6th, when they first had the ability to produce this document, through December 26th. So what it does is it provides you with how many students at each of those schools. Now, those could be My School Online students that are actually not in the brick and mortar building. They could also be in the brick and mortar building. And we have, by and large, a majority of our students in the buildings. So that number of students then is compared in the next column to the student enrollment that we pulled yesterday to give board members, to give staffs, and to give parents kind of a picture. Because what happens is, I think you hear about some positive cases developing, and all of a sudden it seems like every other student in a school is positive for COVID, and it's actually not the case, but I just wanted to share this. So we use the term positivity rate in the health industry when you have a number of people that take a test for the COVID, and then what percentage of them become positive. So we're not talking about that in this context. So if you look at an example of the first school on the list, it identifies 13 student cases. That would be 13 identified positive student cases from September 6th, essentially until Christmas break. 13 in the entire school. And so what I wanted to indicate there was there's a student enrollment of 938 at that school. So that gives you a student positivity factor of 1.4%. So essentially 98.6% of the students at that school have not been COVID positive. So it gives a kind of a way to look, way to compare, and it's not surprising to me that when you look at these schools, the high schools have a higher rate of students positive for COVID. They're more active, they change class periods more, they are involved in activities, but more importantly than that, and key, and I'll get to this in a minute, is high school students do a lot more outside of the school building interacting with each other when we don't have the ability to control, to talk to them, to counsel them. And so many of them have jobs, many of them go to work. So what you'll see in a minute is, and of the report that we've received, the last one we received from the health department, and I'm not a health scientist, indicated that only 1 out of 10 of our positive student cases resulted from transmission within the school building. And I'm not a health scientist, but that's the information that we were provided, the latest we were provided by the health department, 1 out of 10. So when you see these numbers, is the question, can the schools always do better? Can we do better? We always are striving to do better, but a lot of what's going on out there is occurring outside of the schools. And we have anecdotal, stories that we could share about, students who's been quarantined. They're not positive, but they've been contact traced, and yet they show up over here and doing this and other things. And so it's important to recognize that it is a community-wide effort for everyone to kind of to do their part. The bottom piece of this is a summary that just shows you at the elementary, middle, high school, and then combination school level what the incidences look like on average across the district. 98% of our students have not tested positive for COVID, right? 2% have. So I think it's important contextually to know that 30,000 plus students in our district the vast, vast, vast majority of them have not contracted that illness. So we are doing some things right in the school. We can always do better, and I think we're going to continue to work.
And just do me a favor, if you would highlight the far right column as well.
Yes. So the far right column is it's a state-produced column as well, and that shows you a total of all other staff, teachers, and they even have an unknown category. It might be because, and I didn't clarify, but because they weren't sure the position that the individual held. That number is all other non-student at the school positive cases since September 6th. So when we report that information, and I will say, there's a lot of numbers to keep up with, and so in some cases, when I looked at what the state showed, the weeks, they go through the 26th of December, so a parent might go to our website and see a number, and then go to this site and see a different number. They're not vastly different, but there always could be some overlapping or missing numbers based on the week that we're looking at.
All right, any questions?
And it's noted, too, that we have, some schools have had no cases with their faculty staff, or very small, so that's,
Well, that question was, so when you go to the state site, if the school is not there at all, then that indicates that they have nothing reported.
that's great.
Yes, ma'am.
Thank you.
So just continuing on with this part of the presentation. So, Board, as you know, we made the decision in the summer to hire some contact tracers. We had hired 3. And to the professionalism and dedication of that group, we also have some of the supervisors who have also taken a role in contact tracing as well in order to help. And what I mean by that is in order to, when I say expedite, so you can do this in an efficient manner to ensure that we are making a difference in doing the contact tracing in a timely manner, so we are as expeditious as possible, okay? So I do want to just say, we have a few of them who are here today who are going to share just a little bit of information. I want to thank them and the other contact tracers who are not here. Terry Schroeder, whose job is in essence morphed into contact tracing. These individuals, and just very specifically Terry, but the individuals as well, for a certain portion of months, in essence, we're working 7 days a week in order to make sure that we were as safe as possible with our employees and with our students. And I know I appreciate them. I know you all appreciate them. I know our staff and schools do. But I will say, in that vein, when they show up, they're not being received with a smile. It's a tough job. So I just want Terry, and then she will lead this group right here to come up and just give a little perspective.
All right. So, Mr. Chambers, if it's okay, as Terry's making her way up, and I think I can speak on behalf of the board, if that's okay. Terry, thank you so much for all that you do, and I know you are surrounded by a wonderful team, and I know I've told you personally, and I'm sure all the other board members have told you personally, how much we appreciate what you're doing. And the fact that you're coming up here right now and you have that wonderful smile on your face says it all, that you are dedicated to what's going on out there. And, this, like Mr. Chambers said, this is something, unprecedented. And you're taking it and running with it, and I truly appreciate all that you've done. So I just wanted you to be recognized for that.
Thank you, Chippy. Sure. And your encouraging responses when I send you the reports and such, I appreciate that as well. I will say that COVID-19 has brought me back to my roots. Of course, I'm a registered nurse and spent quite a few years prior to being in the school district in nursing. So it's definitely brought me back to my roots of medicine. I do miss the education piece, though, I will tell you that. So I'm looking forward to the day that we can get back to just educating kids and meeting the kids' needs in that avenue. I do miss the mental health piece because I'm not able to do a lot of that either, and I do know that that is definitely part of this whole adventure that we're on. So I also want to take a minute to thank Mr. Chambers, Ms. Lightbourne. Mr. Chambers graciously reached out and wanted to hear from our contact tracers yesterday, and he set up a virtual meeting and listened to their input, what they've learned, what they've seen, what they've noticed. He heard with a very open ear some of the challenges that they're facing, and the work that they do, and I know that each one of them appreciated just the opportunity to share with you the work that they're doing. So thank you for taking the time on their behalf to listen. So I'm going to just start with just a quick overview of what contact tracing is, and then I'm going to turn the rest over to Bobby Davis, who is the program director for Aviana, who has worked tirelessly alongside of me working this program, doing this work. And then we have Sophia Daldine, who is also one of the supervisors with Aviana, who has picked up the additional responsibility of COVID tracing or contact tracing at her schools. The 3 contact tracers are out doing their work today, so they could not join us today, but they're doing a fabulous job. So who is doing this tracing in our schools? Aviana contact tracers, we have 3 of them that we have employed through Aviana, of course. There are 5 supervisors. They have 6, but one of them does not because she's brand new this year, so she's learning the supervisor role. But 5 of their other supervisors are doing this work. And the school COVID administrators, my goodness, the work that they're doing at the school, not just contact tracing, but making sure the mitigation measures are being followed, making sure that things are running like we have given them the expectations from the district level. This is what we need to do. They're doing a fabulous job. I will say that quite a few of them are principals, so imagine this work on top of being a principal, and then some are assistant principals, disciplinarians, so imagine again that work being interrupted at any moment that somebody shows up or we get a call or whatever, and they have to stop what they're doing and pick up this piece. So those are the folks that are out there doing it. I'm doing quite a bit of it from my office desk, on the phone, talking to principals, I pretty much do everything outside of the school piece, our district offices, transportation, and that realm. So I'm doing some of that as well from my office. So I want to give you just a quick picture of what does the contact tracing look like, and I'm going to go step by step so you can see the process. First of all, we get the report. I will say usually the report comes from the parent, which means that either the Department of Health has not yet been notified, and so at that point we have to go do some research because we have to confirm that result. We can't just take somebody's word for it and then quarantine students based on just somebody saying, yeah, I'm positive. So we go get confirmation on that, whether it's we ask for a lab result. Hey, can you send us that lab result? We call the health department if we can't get the lab result, but we don't do anything. We don't move forward on anything until we absolutely have confirmation that that is indeed a positive case. We can get it from staff members, and we can get it directly from the Department of Health. So once we get that, and once we have that confirmation, the wheels start rolling. And here's what happens. The schools start with gathering the information. What kind of information do we gather? Seating charts. We look at transportations. How did that positive case get to school? Car rider, bus rider, walker. How do they get to school? Because that makes a difference on who's contact trace. In the secondary levels, extracurricular activities and athletics. That's a big piece that we have to follow up on. Attendance. We need to look at the positive cases attendance. Were they there during their infectious period? Because obviously we're not going to quarantine students based on the fact that they weren't there when they were infectious. So we have to look at that. Once we get that information together, then we look at, okay, who are the close contacts? Who was within 6 feet of this positive case for 15 minutes or more? And I'm going to tell you that in most cases, we're going room to room to look at that. And in a lot of cases, we're taking a tape measure, a yardstick, something to measure 6 feet. Because again, we want to go by what the directives are from the CDC and the Department of Health. So parents can rest assured that we're doing everything we can to make sure that we're making that definition of close contact. And it's 15 minutes or more cumulative, which changed kind of early on in the school year from being in a 24-hour period or at one time to a cumulative. After we determine who are those close contacts, then we have to look at attendance. We have to look at, was that person that's named on that seating chart, were they in attendance at school that day? Because obviously if they weren't at school on the day that they were in close contact with that positive case, they're not exposed. So that's a big piece, especially in the secondary, because now you're looking at block schedules. You have to look at two separate, if the case was there on two separate days or 2 days in a row, then you have, the Monday, Wednesday, Friday schedule, then you have the Tuesday, Thursday schedule. So you have to look at the attendance, and that's a cumbersome piece to the puzzle. I'll tell you that the attendance clerks are just absolutely fabulous with getting that information to our COVID team, to our administrators, so that they can do that work and make sure that the attendance is verified. After that, we look at what is the quarantine time frame. 14 days, at this point, it's 14 days from the last exposure. Okay, so let's say you had a secondary student that was in school on Monday, Tuesday, then the case was there on Monday, Tuesday, the last day of contact is Tuesday. Okay, now let's say one of those was not there on Tuesday. The last day of contact for the person who wasn't there on Tuesday is Monday. And that is looked at for each individual contact. Okay, so again, it does get to be a little time consuming to do that, because again, we don't want to send kids home that don't need to go home. After we do that, we pull those close contacts. Each school has their own method. The COVID administrator has kind of set up a method, at each school to pull those kids, and then they start to call the parents. So those kids are usually in a centralized location for parents to come and pick up. Of course, they're monitoring that social distancing, they're monitoring everything they can, and then the parents are then notified at the same time that those kids are being pulled to come pick those students up and take them home for their quarantine period.
And Terry, on
Yes,
that
sir?
piece, how many students might be being called, and how long does it normally take for those students to be called?
It takes a little while. Let's take, for example, a high school. You've got 7 periods. Okay, so you're looking at 7 different classes, and let's say you have a desk here, and you've got this desk, and they're all within 6 feet. So now you've got 4 contacts in that class. Okay, then you go on to the next class, and you've got 4 contacts in that class. And you do that for each one of the class periods. So let's take 4 times 7. Now you've got 28 close contacts, and that person's a band member or a football player or an extracurricular. Now you've added a few more into that. And so we could get upwards of 40, 50 contacts at a high school level fairly easily. And so now we're calling that many parents. It's a team effort. I will tell you that the schools have put together a great system, and they gather as many folks as they can to make those calls. They do have a script that they use so that all the parents are getting the same information from each person that makes that call.
And I asked that question because, one, we know that the quarantining, we know that the contact tracing piece can be frustrating. But once again, we want to be safe, and it's something that we must do. But I also asked that question because you talk about 40 or 50 people, and the schools will stay till 6, they'll stay till 8, and they're making those calls until everybody gets contacted.
Yeah, it's a task. And then after that, every student, every contact goes home with a letter from the Department of Health explaining quarantining, explaining that they're going to be receiving a call, and also explaining that pretty much all of this is happening under the authority and direction and collaboration of the Department of Health, because they ultimately have the final say. We are collaborating with them, we're partnering with them, but they ultimately have the final say. And I know some of you may be thinking just a little bit about, okay, what about the 7 days early release or the 11-day early release? And those changes are through the Department of Health. They are the ones that determine at this point. We're working with them on it. We're trying to put some things in place, but right now they have told us that they are the ones that release from early quarantine. They have to counsel those parents, those students, before releasing the asymptomatics back to school early, or the ones that have tested out of quarantine. So again, that's fairly new. That came out right before Christmas break. So we're still tweaking our processes on that, just like we did at the beginning. We had to tweak our processes. So I'm sure we'll get into some type of smoother, but right now it's a little in flux right now.
Well, I think that's one of the things that I've heard from parents is just, you have so many different, 7 days, 10 days, 14
Right.
days, it's just really been confusing to the
Yes, sir.
parents, especially when their kids are being quarantined and, end up not testing positive at all, so.
And I agree with them. It is frustrating. I appreciate the fact that they've looked at and implemented that. Again, we're all trying to, and I will tell you, I'm on some email threads from other districts, and I see that everybody's kind of struggling, and everybody's doing it a little bit differently. So we'll find our way here and get that implemented with a little bit more smooth situation. But we have to, again, everything operates under their authority, and so that's where we're at. I will say that they've been, the Department of Health in Okaloosa has been a great partner with us in all of this, and so we certainly appreciate their collaboration on that. And then one final part of that process is then a robocall or an all-call goes out to that school community. And I know that parents are getting a little tired of getting robocalls, but we have committed to transparency in our schools. And so with every positive case at a school, that robocall goes out so parents can be aware that this is what has happened today at your child's school.
Can I ask you one question,
Yes,
just
ma'am.
for clarity, because a parent has asked me this question.
Yes, ma'am.
So a student of a close contact is home on quarantine,
Mhm.
and hear that they could test out of quarantine.
Mhm.
And I heard you say that, I think, a minute ago, but isn't there a period of time in which that
Yes,
is
ma'am.
valid? They can't just automatically go home and be
That is
tested?
correct. That is
So
correct. CDC guidelines
need to know that.
require, CDC guidelines require nothing sooner than day 6 after exposure. That it's not day 6 of your quarantine, it's day 6 after exposure, and it has to be the PCR test. It cannot be a rapid test.
Exactly.
And again, all of that goes through the Department of Health because they're the medical experts on testing and all of that. So that goes through
Thank
them.
you.
Yes, ma'am.
So why wouldn't the rapid testing be, I don't understand why, their doctor's offices are offering rapid testing, but why wouldn't that be, I don't mean to make it a trick question.
I understand.
but-
And again, I'm learning all this too because this pandemic is new to all of us. But the rapid test is also one of those tests that, like, say, for example, CDC says that if a person is symptomatic and they test negative on the rapid test, there's the recommendation that they do the PCR, because I'm assuming that there's probably more false negatives than false positives on that. But I'm not the expert on COVID testing.
Any other questions?
Okay, so at this time, I'm going to ask Bobby Davis to come on up. She wants to share with you, again, after Mr. Chambers heard some of their input yesterday, she wants to share some of the things that she's seeing out there at the schools, things that they're doing, and then some of the things that we've noticed that have become something that we're either going to improve or that they're doing a great job on.
So, Ms. Davis, before you get started, just briefly tell us what your job description is, so all of us would know and the general public would know.
I am the program director, the school health program director for Okaloosa County. I am contracted and I work for Aviana Healthcare. I've been now here in school health in Okaloosa County for 14 years, and as a director, I really appreciate the being able to be here to help everyone, and I love my job. I love the school. I think everybody here is wonderful, and I feel like this is where I'm meant to be.
Thank you very much.
And thank you. Thank you for your time this morning. I know y'all are busy, but I do want to, after speaking with Mr. Chambers yesterday, I wanted to, being on the forefront and being in the schools and working with the administrators and the school support staff directly every day, I wanted to give y'all a little insight on what I see. As Mr. Chambers said, we're not always welcomed with a big smile, but we truly are welcomed with a smile. The schools have been so supportive of us, and it's been rough. It's been a tough year for the administrators and for the students and for the staff to adapt to all these changes, but they're doing a fabulous job. Going into every school, they have the dividers up, between the desks, which is fabulous. It's a huge help. We're noticing the teachers are now getting more and more involved, and they're measuring their classrooms every morning, because they're afraid a student has moved a desk, 4 inches this way. They're measuring to make sure that the desks are all 6 feet apart or as far apart as they can be. That's one of the challenges that we are seeing is the classrooms are very small, but that's something that they're working with. They're doing everything they can to adapt to keep the classrooms, as safe as possible for their students. So with what they're given to work with, I think they're doing a great job. We're seeing They're encouraging hand washing. We've got the hand sanitizing stations everywhere. A big challenge we're seeing is the seating charts, with students moving around. Teachers are keeping updated seating charts for us, so when we go in, it makes it quicker and easier for us to do our contact tracing and determine who is, 6 feet or closer to the positive case that we've been given. But with students moving around, and then again with block schedules, and then, this day we have a group that needs to meet, so they're moving over here, so we have to, that's what we're working on right now, is to make sure that with every day, with every change that's going on in a classroom, that the teachers are trying to keep as accurate seating charts as they can, so it helps us. Because sometimes we have to look back 3 and 4 days, and it's hard to remember exactly who was where 3 or 4 days ago when we get our list of, who we're tracing. The support staff in the schools have been absolutely amazing. The attendance secretaries, the guidance secretaries, and I know I'm going to leave people out, but the guidance counselors, they're all helping. Everybody has been so helpful looking up attendance for us, which is very, very tedious, because we want to make sure that if we are quarantining a student due to close contact, that they actually were there. So looking at every student's attendance for every day, every class period, to make sure that they weren't testing or they weren't over here doing a project. It becomes very tedious, but the support staff have been absolutely wonderful helping us with that. The administrators, I can't say enough positive about them. The principals, the APs, they are staying late hours with us up till 8 o'clock, as Mr. Chambers had said, making phone calls, making sure that these parents are notified, so they don't, we want to notify them as quickly and timely as we can. And so we are staying late and making these phone calls to make sure we reach everybody. Custodians, we see custodians constantly cleaning, and when we are calling students out to get parents to come get them, we do have separate areas set up in every school that is allocated for these students. We do try and keep them 6 feet apart while they are sitting there waiting for a parent to come get them. As soon as that area is cleared, we notify the custodians, and they come in, and not only doing their job, then they come in and now they have an extra area to extra clean, and they're doing a great job with that. So I do want to commend everybody in the school system with as much support and help, and everybody has chipped in. It's a big team, and it takes this team to work together to make it smoothly function, and they're doing a great job. Like I said, the few things that we have noticed would be the seating charts and the buses. We do need to make sure that we're keeping accurate seating charts. The bus seating charts are imperative. They are small areas. The students are wearing masks on them, but they are very, very close quarters, small areas, and so we need to try and keep as accurate records on the seating charts on those. And then the classroom size, unless we can make the classrooms grow, I think with what we have and what we're working with, I think they're doing a great job.
Any comments?
Just thank you very much.
Yes.
So, thank you.
So real quick, Ms. Davis, before you leave, I have to tell a quick story about you. So I've known you for a long time. And you were at Richburg Middle School when it was Richburg Middle School. And I had no earthly idea that you were the school nurse, because her job, when I got to meet her, was out at the car line. She was the one that held up the stop sign. So, just to comment on how our nurses are a part of the team of schools, that's how I met you. You were the person that made sure we all stayed in our lines and all that. So.
I took my job serious too.
So I had to tell that story just to make sure that people knew how vital our nurses and our nursing people are in the schools, that they do more than just nursing. So
we want to be a part of the team.
Yes.
And that's our biggest thing, and that's what I encourage with our staff is you may work for Aviana, but we work with you, and that's what's important to us.
I want to know if Mr. Bryant followed the rules when you were out there.
Well, probably not.
Chances are.
Chances are, no.
Chances are.
she always had a smile on her face. So
Well, thank you again for your time.
thank you, Ms. Davis.
And then we've also asked Sophia Daldine. Come on up, Sophia. Sophia is one of the supervisors. Bobby runs our program through Aviana, and then Sophia is one of our supervisors who's taking double task right now. She just had a couple things she wanted to share from our meeting yesterday about how the community can help us with this whole situation in our schools.
Good morning.
Good morning.
Thank you for being here.
Thank you, Mr. Bryant, and School Board, Mr. Chambers, all the guests. Appreciate you affording me the opportunity to come and speak to you about coronavirus in the school system. At this time, I'd like to discuss what we've noticed in the classrooms. Ms. Schroeder talked to you about contact tracing and how that process is carried out, and Ms. Davis just came and told you some of the provisions that have been set forth in the classrooms to ensure safety and sanitation. There are a couple of things that I've noticed in the classroom I think I need to expound on. One, classroom size. The physical square footage of the classroom cannot be altered at this time. And that can be directly related to the increased numbers that you're seeing here in the high school. When you have a class size of 20 to 30 students in a given setting, and you're trying to put those desks in a small area, it's almost virtually impossible to social distance those desks 6 feet apart. And because of that, more students are being quarantined with each particular positive case. Also, our seating arrangements. Some of you are educators, and you know how seating arrangements can impact communication with the students, with the teachers, with one another, within a given setting. It also impacts student engagement and motivation and focus. With that being said, in a given classroom, there may be multiple seating arrangements to facilitate the learning process. We're in block schedules in the high schools right now. Monday, Wednesday, Friday are your even days. Your odd days, sorry. Let's just say a given classroom has what we refer to maybe as a classical seating arrangement, just normal alignment of desk. To facilitate the learning process, they may pull out into small groups. They may put them into pods. That way, the students are interacting with different students, giving them a little bit more of a challenge, different intellect, different opinions that they can collaborate on. That in itself, if you change those seating arrangements, not only one day, but maybe on a Monday, but maybe on a Wednesday also, and then by the time you get to Friday, you incorporate maybe a second or third seating arrangement, you are almost doubling and sometimes tripling the amount of students that are being quarantined at a given time. And I'm not saying this to say we do not need flexible seating arrangements, because I do not want the learning process to be hindered in any way. But I think that we really need to look at it and try to keep our seating arrangements as constant as possible, especially during these next few months when the number of coronavirus cases are probably going to continue to increase. With that being said, it is imperative that educators keep current seating charts so that when we come into the school setting to actually quarantine those individuals who are in close contact with a positive case, it makes the process much more easy to identify those that we need to quarantine. We also need to keep those seating charts updated for the buses, as well as Ms. Schroeder and Ms. Davis mentioned earlier. At this time, we're seeing an increased number in positive cases in our district, as well as in the county and all over the United States. We must come together as a community. This is just not an individual effort. It's not just that on the student, the parent, the educators, but us as a community. And to be a collaborative unit, to ensure that we're doing all that we can to decrease or to lower the chances of spreading the coronavirus. And by doing that, what we need to do is continue to focus on the mitigation measures. And by that, I mean social distancing. If at all possible, keeping 6 feet or greater in between ourselves and our students as a unit. Proper hand washing techniques. I cannot emphasize enough the importance of hand washing. If you think about a given time that you touch something and you have your eye itches or your nose itches, our hands just naturally go to those areas. So the more we wash our hands, the less likely we are to spread germs, and especially under the nails. That's a big source of harboring bacteria and germs. When proper hand washing or soap and water is not available, hand sanitizer has been proven to be extremely effective, and we need to encourage the use of that in the classroom setting and outside as well. Mask wearing, we've heard it. We're actually putting that into play. There are certain techniques that are acceptable in applying a mask and removing it and storing it. You can refer to the Center of Disease Control, CDC, for those techniques. And we know that, students, especially the younger ones, are not going to heed the proper techniques, but we just need to be positive and encourage them and instruct them on proper wear and storage. It's imperative that parents keep quarantined students at home. As we've heard before, we have a lot of social butterflies in our high schools, and that's a normal part of life. But when the health department imposes a quarantine, parents need to heed that instruction from the health department. Keep these children home during this period of time. It's very difficult, because at this age they're invincible. I'm just quarantined. I'm not positive. I do not feel any different. So why, of course I can't go to school. But what that means is also outside the school setting, they need to remain in the home. They need to keep from going to sport practices or clubs, or, stores, restaurants, wherever they may frequent, because you never know when you may actually become positive. There's no way of knowing when you're first quarantined. We're looking at upward of day 5 for developing symptoms. And with that being said, some people never even develop symptoms. They stay asymptomatic throughout. So if we can keep those quarantined individuals in their homes, of course, that too is going to decrease the chance of spreading the coronavirus. Also, what I've noticed, especially coming back from the Christmas break, is parents are sending students who are symptomatic to school. That in itself imposes a greater chance of spreading whatever viral illness or that they have at the time. So we need to be supportive of parents and encourage them to keep their children home if they're developing any symptoms whatsoever. That's a big one. And lastly, if a parent feels like their child needs to be tested, they need to keep their child home until those test results come back. Oftentimes what we're seeing is a student comes to school on a Monday, and say by Wednesday they may have the sniffles, they may have a little scratchy throat, they're not febrile, they're not running a fever, and they may or may not feel like they're really sick. What used to be the norm is no longer the norm. So the student comes home, says, I'm not feeling well. The parent takes them and they're tested. Well, it's going to take at least 48 hours or more for a PCR result to come back. The student stays in school. By Friday, the parent calls the school and needs to check the student out because they now have the result and they're positive. But the fact is they've been in the school in their classes all week long, and so that's just going to affect all the other students and their learning process, because had that parent kept that student home while they had symptoms, then all of these other children who are about to be quarantined would not be in the situation that they are. So.
Any questions or?
Yes, ma'am. I know that you didn't mention anything about vaccine, and I know the CDC has not really recommended vaccines for children. And we're looking, that's what we're talking about. But with your health group, Ariana?
Yes.
Are you making any recommendations on vaccines for when they're available to employees?
Aviana, as the healthcare group, will release that information once they've actually come to a decision. That's still in the works. So we expect to hear very soon. We did receive some information over the holidays for staff members, and so we're just waiting for that schedule to be released.
Okay,
But
thank you.
as to, recommend for anyone, we're going to rely on the health department.
Don't you come and give vaccines to students?
No,
Is this
ma'am.
group? We
No,
have
ma'am.
somebody does it, yeah, somebody.
That would be a different contracted
Gotcha.
company,
Okay.
but not us.
All right, thank you.
Any other questions?
All right.
Thank you.
Thank you very much.
Thank you very much for letting me.
Yes.
Thank you.
Mr. Chambers?
So to kind of sum up, and I thank you, ladies, starting from the beginning in terms of how things were, how they currently are, the efforts that are going into place to be safe, things that we can do better, that we continue to look at. Just wanted to give kind of a comprehensive look at where we are in this school district, the things that are going well, the things that we need to do better. And we always talk about, we're definitely not perfect, but we definitely are putting in measures, and we definitely are trying. This is a taxing time on employees, because not only are they employees, they're family members. They have to go home as well. So these are difficult times, but I choose to also believe that, like I said earlier, there are heroes amongst us doing great work.
And Mr. Chambers, continue on the vaccine piece, if you don't mind. I saw a press release that we get from a news service, and it says that Governor DeSantis at this time is saying that school employees are not considered frontline as far as like you would have as a medical worker. So that would not, in other words, bump them up in priority to get a vaccine. Do you have any additional information or anything beyond that?
So beyond that, no. What I will say is myself, as well as the Superintendents Association, I know a letter was delivered to the governor asking that school officials be considered in the priority for this vaccine. And we see what the result is right now.
Yes.
And I'll just say right now. But I know that myself and the Superintendents Association will continue impressing upon that, because I think we would consider our teachers, our support professionals, our administrators, our district folks, as well as frontline workers who every single day are giving their all and putting themselves in a situation where they can contract this virus. So I think it is important to hopefully get there, and we will continue to give that input.
Thank you.
Thank you. Anything else, Mr. Chambers?
That is it. I know it took a while, but I appreciate it.
No, I know as a board, we appreciate the fact that you had these folks come in and talk, and that you took time to listen to the contract tracers and what's going on in their positions and all. So it's very much appreciated, and I know the general public would be, the ones that are watching right now are very appreciative of the information that was given today. So, all right, so we'll move down to board members' announcements and requests for information. And Dr. White, I'll start with you. Do you have anything you would like to talk about today?
Thank you, Mr. Bryant. No, nothing that hasn't already been said. Thank you.
Okay. Thank you, Dr. White. And Dr. Kelly?
Well, I just wanted to add on to something that Mr. Chambers said. Certainly agree with everything you said about how COVID and the whole pandemic arena has changed the face of education. And when you were talking, it reminded me of one of the things I think this pandemic has really taken away from us as educators is that human touch, the contact. I think about many psychological studies that have been done on newborns, for instance, that say even though they can survive without human touch, they don't thrive without it. So I think about our students, that we know that even if we give them a high five or a coach pats them on the back or a fist bump, it's just so meaningful. The little tidbits of human contact that previously we took for granted, that in today's world they're so meaningful, and it's very hard to do that in a digital world. And so I think that we're missing that. But I also I think about all the students and the teachers and parents that you mentioned, but particularly our teachers that are doing hybrid. They're doing some classes online and some classes face-to-face, and how they must make that adjustment. So I do think, as you said, there are many heroes amongst us. But I also had another thought that, Okaloosa County has done such a great job, and our people, as you say, it really is attributable to our people to having done this so successfully. But all of America and all of the counties, the nations globally. So I think another thing this has had us look at as educators is a global perspective of what this pandemic will have done when we reach the end of this. So that's all I had to say on that. But I did also, that I love to look at the calendar and look at where we've been and where we're going. So I have to say that we only have 6 more school days left until Martin Luther King and 10 more work days left until the end of this grading period. So some significant mile markers coming up, and then other things to happen after that. So all good things. Thank you.
Thank you, Dr. Kelly. And Ms. Evanchek.
Yes, okay, thank you. Okay, so I'm going to say it about my Baker Gators. I'm not going to go too much because I know we're going to have those players and all that, but we do have a state championship football team in Okaloosa County this year. And what a way to end 2020 right there. And I'm just, of course, so proud of them. And like I said, I won't carry on, but had to mention it. We'll have them here. We're working out of time to try to get those students and everybody here. So how exciting that is. So I do want to, on the athletic front, talk about a former student that I had as a teacher. One of my last years teaching at Choctaw High School, I had a student named Richie Grant. And I want to talk about Richie Grant a minute because he just graduated in December from the University of Central Florida. And I've been in touch with him, and he was named first team for the American Athletic Conference. And he was also given an invitation to the Senior Bowl, which he'll be playing in at the end of this month. But what I'm most excited about is tonight on ESPN, Richie Grant is one of 3 national finalists for the Jim Thorpe Award, which recognizes the most outstanding defensive backs in our country. And I can tell you, you think I was excited about the Gators. I'm very excited about this young fellow who, I don't want to tell all his business, but went against a lot of odds. He did not have an easy road, but always, if you've ever seen him, his smile would light this room up. We could just turn off the lights. But he's really proved what you can do when you really set your mind to it. So let's cheer on for Richie Grant tonight, whether or not he gets that top award. I mean, to be that 3 top in the country, and of course he indicated to me he is draft eligible at this time, so we may be seeing Mr. Grant in the NFL, which thrills me. I do have a question of Dr. Kelly. Are we going to be knowing soon about the Citizen Committee for the sales tax? Is that coming out?
I think so. I think that's being chaired through other organizations, but we'll know who that is.
I think Mr. Chambers can actually talk about that
I
right
can.
now.
So simplistically speaking, right now, it's still going through the process right now. And we hope to have that list very soon.
Okay, great. And I just have one last thing I'd like to say, if everybody give me this. I just want to make a statement at, being an elected official. Democracy can be messy. And in the last few weeks and months, we've certainly seen that. But I just want to say that I'm still very proud to be a citizen of these United States. Wouldn't want to be anywhere else. And as we enter 2021, I am continue to be humbled and honored to work with these professionals here and to serve on this board. And I wouldn't want to do it in any other district, county in this country. And I appreciate the confidence that the citizens continue to have in me and working on this board. Thank you.
Thank you, Ms. Evanchek. And Ms. Gardner.
Yes, I've been working with Patrick Strong, and we have been going through 52 different applicants for Ed Support of the Year. Amazing. I mean, that was really so rewarding to read, and we all know what these individuals are doing and how helpful they are for our school. We have selected our top 9, We have interviews coming up on the 15th of this month, so stay tuned. We will be announcing those top 3 individuals. And again, when you read about the 55 different applicants, everything from our bus drivers and our custodians and our lunchroom monitors, you know, sometimes these individuals are behind the scene and they may not always get the recognition, but I know as a previous principal that these people, they do make the school a brighter place, and we really cannot do without them. So stay tuned to see, again, our top 3, and probably Patrick Strong will have more to say down the road. Happy New Year. I'm hoping 2021, hoping and praying will be much brighter. And so that's all I have at this point.
All right. Well, thank you, Ms. Gardner. And I just have a couple of things. I just want to first recognize Crestview High School's band director, Jody Dunn, and I'm trying to read it off of Facebook here, but Mr. Dunn received the Oliver Hobbs Award, which is a recognition of the commitment and superior performance of his band, as well as his commitment and service to his students as their band director. So congratulations to Mr. Dunn on receiving this prestigious award. And for those of you, know Dr. Kelly does, you know, how dedicated all of our band directors are, because we do have some of the finest bands in all of the United States, and it's because of people like Mr. Dunn who give themselves of their time and their efforts that we have such marvelous band programs within our county. And also, board members, I received some information the other day. Actually, Jan received it, and I have given y'all some information, and we don't have to make a decision today. And Dr. White, you'll be getting a copy via email, but it's the Florida School Board Association is wanting to know if we would like to participate in the 2021-2022 Master Board Program. And this is an opportunity for all of us as board members to go through a program which would help us be better school board members, of course, but also to go through their leadership program. And at the end of the program, we would become a master board. And that doesn't happen very often within the state of Florida. And of course, you know, it has to have a commitment from the school board. So I've given y'all a hard copy of everything. And as we have until March 1st to make a decision, but y'all let me know what you think. And, you know, if it's something we want to do, then we would definitely need to have our commitment to it. But if not, then I'm okay with it.
I have a couple of questions.
Yeah.
Thank you, Mr. Bryant. So I've looked at this before, and I think it requires a commitment of a majority of the board and the superintendent to attend a majority of the courses that are provided.
Right.
And so, but I have a question. Maybe I should pose this to Tina Pinkerton, who coordinates the program. In the age of COVID, if there is an online opportunity, and if they count those the same as they do for the face-to-face. So I know it would be awfully hard probably to get Mr. Chambers away from his office for all of these courses, and some others of us might have some travel restrictions from time to time. So those would be questions if you want to chair that and find out. I think that would be helpful to us as we make this decision. But I have looked into it before. I think it would be a wonderful opportunity if we could all make the commitment, but I think if they provided an online option, it would help many of us to make that choice.
And I will
certainly a superintendent.
And Mr. Bryant?
Yes, sir.
I have a follow-up question to that as well. Would you be able to, or perhaps the School Board Association could provide some idea of cost, including cost of travel and lodging for such an endeavor?
Well, they actually have the program fee is on here. It is for member districts, which we are a member, it's $4,500. I don't see anything on there about travel and all, but I will ask in regards to Dr. Kelly's question about doing, you know, online meetings and things like that.
And also,
right, I think there would be some information that would be important regarding lodging and hotel costs and those kinds of things before I would be willing to make such a commitment.
Well,
and that would be important to know. Thank you.
Well, thank you, Dr. White, and I will definitely take note of that I'll ask those questions regarding the expenses that go with that. Ms. Sedantia?
So, for example, you and I attended a conference right before the holidays. would that go into this, or is this totally separate thing?
I believe that is totally separate, and it
Okay.
goes toward your.
Personal,
Your
but
personal.
not for the group.
Right, so and I know Dr. Kelly signed up and Ms. Gardner signed up, so even though they might not have been there on that particular day, they
Yeah.
still have got
Right.
credit for that.
Sure.
So as board members, we actually, when we go to different functions, we have to report it, and then we get credit for that, so we could actually become like a master school board member.
Right,
so.
but as a group, this
Right.
is what this, okay, thank
Right.
you.
And I have a quick question also. I've just kind of skimmed through this quickly. I noticed that the deadline to submit everything is March 1st. Anywhere does it state the timeline of this, when it's going to begin? Did I completely miss that?
I did not see that, but again, that's another question I will ask.
Okay.
I can, call Tina
The
up. or-
20 hours, we're talking a month, are we talking 6 months? What are we?
It's usually, I believe it's within a year period, yeah.
Oh, okay.
Yeah, it's
Okay.
not all at once.
It's not, okay.
Yeah, yeah. But I can talk, I know Escambia County was a master board not too long ago, so I can probably reach out to one of their board members and ask them some of the, what they went through. And of course, that was
Yeah,
pre-COVID, so.
It's a 20-hour program.
Yeah.
I don't know how many hours are delivered at once in a
Right.
day,
But,
but it's pretty substantial.
But as Dr. Kelly has asked, and I'll be that liaison, I'll ask all those questions. And of course, it is something that is, I think would be good, but again, it's totally up to us as a board, so. All right, and so we'll move down to section 16, which will be the 2-minute version of public comment, and section 17. But before I do that, Rita, anything? Dr. Hale, anything? Sheila? Steve? Jordan? All right, this meeting's adjourned.
Thank you, thank you.
Thank you, good.
Nice job as always.
Y'all did awesome.